Well, good morning or good afternoon or good evening, wherever you are. My name is Chris Salem. I'm your host. I am looking forward to serving today as your host here for the Navigator, navigating the AI revolution in healthcare. And we're going to be getting started here shortly, but I wanted to give everyone just a kind of a breakdown of what we're going to be discussing in this valuable webinar that you'll be partaking in today for an hour. We're going to be learning and discovering in this webinar how AI combined with digital twins, blockchain, semantic web, and federated learning is transforming healthcare into a secure, decentralized, and interoperable ecosystem. The critical role of AI enhancing precision health through approaches like multiomics, patient-generated data, environmental data will tailor care uniquely to individual needs. Also, we're going to be talking about the challenges of cyber ethics, sustainability, and equity in AI applications within healthcare, focusing on privacy, environmental impacts, and equitable access to AI technologies. In addition, you can anticipate effective strategies that will be discussed for AI deployment in healthcare settings, including multidisciplinary collaboration, robust data governance, and integration of augmented intelligence in clinical workflows. And finally, we're going to be talking about upcoming innovations in AI for healthcare, such as brain computer interfaces, quantum computing, and 6G connectivity, and their potential to redefine diagnostic treatments and patient interactions. And I'm going to be so excited to see here today that we're going to be hearing this today from Professor Dr. Ingrid Vasiliu-Feltes. And before we bring her on, I do want to go over a few housekeeping items here today. We do have a chat box off to the right. If you have any questions at any time during today's discussion, feel free to share there. I will make sure that we read those off for our presenter today, and she'll be kindly to answer them for you. And again, we encourage you to be engaged. This is what it's all about. And this is where we all get to learn everything here and how we can become better in this particular area. In addition, we're also going to give you some information to register for our upcoming Global Health Tech Summit. That's going to be taking place next month on November 20th. So we'll have a QR code later here during the our session where you can register also for that summit. So there's a lot of valuable information. So we're going to begin here shortly. I'm just going to give you a bio about Dr. Ingrid Vasiliu-Feltes. She is a distinguished leader in healthcare and life sciences with a career spanning over 2 decades, marked by roles as CEO, President, VP, Chief Quality and Safety Officer, Chief Innovation Officer, and Chief Compliance Officer. She has held significant leadership positions across academia, nonprofit, and business sectors. As an alumna of MIT, Harvard, and Stanford, she holds executive certifications in AI, blockchain, finance, meditation and arbitration, entrepreneurship, innovation, and bioethics. She's currently teaching digital transformation in healthcare, healthcare informatics, and population health at the University of Miami Business School, and digital innovation at the WBAF Business School, serving as an affiliate faculty at the University of Miami Miller School of Medicine's Institute for Bioethics and Health Policy. Additionally, she is certified in bio and medical ethics and a certified consultant by the U.S. Institute of Diplomacy and Human Rights, and she is recognized for her expertise in deep tech deployments, particularly AI orchestration and its harmonization with cyber ethics and precision health. She is passionate about advancing hybrid augmented intelligence within the healthcare and life science sectors, contributing to innovative, responsible, secure, and sustainable technology solutions. And without further ado, we welcome Dr. Ingrid to the stage. Dr. Ingrid, are you there?
Yes, thank you for inviting me. It's a pleasure to be here with everyone virtually, and I'm excited about our topic.
Awesome. We are looking forward to hearing from you today, and the stage is yours.
Thank you so much. I'm sharing slide deck. In case someone is not able to see it, please alert me, okay?
Yes, we can see.
Beautiful. So today we decided to dedicate this webinar to navigating the AI revolution in healthcare and specifically overcoming barriers to innovation. As we all know, exciting developments have been occurring in AI deployments, but it's fraught with challenges. So I'm going to mention some of those today and how we can overcome those. Our objective today is to explore the transformation of healthcare delivery through advanced technologies. Also, I want to introduce the concept of precision health powered by AI, which has been exponentially increasing. We will address ethical and sustainability challenges in AI-driven healthcare, strategies for successful AI deployment in healthcare, and the future of AI in healthcare. This is a brief overview of how the webinar is structured. We will start with a high-level overview of the global tech landscape. Then we will explore a few of the key drivers of transformation of healthcare through advanced technologies and some of the exciting converging technologies that we're seeing that combine AI with emerging and frontier tech. Then, of course, we will address the barriers in AI-driven healthcare innovation. And the last section of the webinar will focus on strategies, specifically strategies for the board, for the C-suite, for middle management, and at the employee level. I will conclude with the favorite part, the future of AI in healthcare. So please allow me to share a brief overview of the global tech landscape. There are three major drivers that we're noticing. Increased deep tech investments, unprecedented from the moment we've ever kept track of investments. Increased deep tech adoption that spans not only at enterprise level, but also at the consumer level. And talent shortage and talent migration, which are very important in our conversation today. When we look at the transformation of healthcare delivery through advanced technologies, there are a few novel trends that are emerging, and one of them I will address a little bit more in depth today. Personalized medicine and precision health is a concept that is foreshadowing the next 25, 50 years in society. It is clear that we're transitioning from a traditional care delivery model to a new one where personalized diagnostics, personalized care, personalized prevention are going to be best practice. Additionally, we're going to highlight the fact that advanced diagnostics, advanced medical imaging, advanced pathology are now the cornerstone of precision health. And the major advances in precision pharmacology. We've seen over the last 2 years the ability to generate novel pharmaceutical compounds in a record time. What used to take 15 years now is possible in several months. And of course, as all of you know, telemedicine and virtual care has also been infused by the power of AI. Wellness and preventive health, longevity and aging research has experienced a renaissance with the tools that we have currently available. Surgical robotics and automation are in the perfection stage. We've had them over the last decade, but now with the advanced technologies, we can get to the next level. Smart, remote, and home healthcare, global and public health. Of course, after the pandemic, we have realized that we need to invest much more to be able to be ready for future pandemics. And net zero health. Given the United Nations 2030 and 2050 agenda, we must bring those indicators also in healthcare. So when we look at this tech landscape, it is evident that AI is a great tool and a great enabler showing up in numerous platforms, systems, and tools that are available to us in healthcare. Most often, you will see AI used in combination with other emerging and frontier technologies. Here you have an overview, and I'll go over each one of them to show how their combination can change healthcare and how it's driving healthcare innovation. I promise that I will highlight what precision health is and why the United Nations, as well as the World Health Organization, UNICEF, UNESCO, and all major academic centers worldwide are dedicating themselves to transitioning to precision health and for this to become our standard of care. It is a novel approach to healthcare that focuses on prevention of disease, predicting health risks, and personalizing treatment plans based on an individual's unique genetic, environmental, lifestyle patterns, and behavioral data. Unlike traditional healthcare, which often uses generalized approaches, precision health customizes medical interventions to specific characteristics of each person to optimize outcomes and improve preventive care. It integrates traditional clinical data sets like we've had in legacy systems with insights derived from all the novel advanced technologies like genomics, multiomics, environmental sensors, wearables, all other sensors from our ecosystem that are not traditionally healthcare related, in order to provide a more holistic and accurate view of our individual health risk and our needs. So what can AI do to augment, accelerate, and amplify precision health? Here are some examples. For prevention, AI analyzes genetic, environmental, and lifestyle data to predict disease risks and guide preventive measures. All the wearables and sensors we have now are generating these novel data sets that can greatly augment the traditional clinical sets. Early diagnosis. The AI algorithms that are being generated every day can help us now detect disease much earlier, sometimes years earlier, as we've seen for Alzheimer's as an example, latest data. And it can help us improve our diagnostic accuracy, as we've seen in imaging data powered by AI, specific for dermatology or oncology. As I already alluded to, AI can also help us with personalized treatments, designing customized not only treatment pathways, but also customized medications very soon. Chronic disease management, disease surveillance, post-acute monitoring after patients were inpatient or in an intensive setting, let's say if they had surgery. AI can help quite a lot with monitoring after these acute events to prevent readmission to the hospital. Recent efforts have also amplified the power of AI tools to help us with longevity. Fertility and maternity care, an area that is struggling with showing better outcomes, has also benefited from some amazing developments in AI that can really change the landscape in terms of prevention and reducing mortality for moms, as well as reducing mortality for premature babies. Surgical procedures, as you've seen, AI supports precision surgery by providing real-time imaging, robotic assistance, and very soon we'll see incorporation of genomics data and other sensor data that can really enhance the impact of surgical outcomes. I would like to highlight the AI triad that I think is very important. We keep talking only about generative AI, but there are many other types of AI tools and systems that are equally powerful. And the only difference is that generative AI now has transcended from the enterprise to the larger consumer. But we will see a rise of cognitive AI and adaptive AI that will have even a bigger impact, not only on healthcare, but other industries. So as you already are aware, generative AI can create automated content generation, personalized treatment plans, has already had huge impact on drug discovery and molecular design. Medical imaging has been enhanced for many years, and now it's taking it to the next level to really have performance improvement. Virtual health assistants have basically invaded every facet of our healthcare ecosystem. But cognitive AI can actually change the paradigm for clinical decision support for healthcare providers. It can really enhance our real-time patient monitoring, and it can help with speech and language recognition at a level that we've never had before. Equally important is the combination of generative AI, cognitive AI, and adaptive AI. Not only can we do prediction based on data from the past and current, but it will also be able to adapt based on continuous feedback, which is very important in healthcare. As we know, our health is not static, and our behaviors and lifestyles are not static either. Now that we talked a little bit about the high-level landscape, I would like to highlight a little bit more in depth how AI is a great enabler in healthcare innovation, and that will allude to the challenges that we're experiencing, which will be our next segment. When we look at the combination of digital twins and AI, it's obvious that these models can simulate disease progression, optimize treatment plans, and improve healthcare operations by predicting outcomes, leading to more precise and personalized medical interventions in real time. There are several companies and consortiums around the world who have worked already on a digital twin of the brain, digital twin of the heart, digital twin of the lungs, the kidney, the liver. They have created a digital twin of Alzheimer's disease and multiple sclerosis, and the advancements are occurring every week. The insights we can gain with digital twins and the impact we can have on disease outcomes is phenomenal. Equally important and perhaps more silent this year due to the AI rise is the combination of blockchain and AI. When integrated with AI, blockchain can safeguard sensitive patient data and can enhance digital trust. As you've noticed, the major technology leaders have invested heavily in data mesh and data fabric. The combination of a data mesh and data fabric architecture with AI enhances our ability to integrate, analyze, and derive insights from diverse healthcare data sets, supporting this personalized care and offering increased operational efficiency. Of course, a passion of mine has been the increase in next generation sequencing capabilities over the last few years. We went from a decade ago when it took us 1 year to analyze one human genome and it was $10,000 or more. Now we can do it in less than an hour and it costs $120. The combination of analyzing the vast, rich data sets from next generation sequencing with the power of AI tools is unprecedented. It can allow us to predict disease, it can allow us to identify genetic mutations, and in some cases eradicate diseases, such as we've seen in congenital blindness just recently. Another renaissance that has been highlighted this year is nanotechnology. Once again, more than a decade ago, we thought nanotechnology will become even higher utilized in healthcare than ever before, but it took a little while longer. And now with the power of AI, we see that AI can enhance all the nanotech by analyzing vast data sets, again, from the nano devices that we have and allowing the real-time strategic intelligence to help clinicians in their decision-making. Computational biology and AI, if you look at the pharma industry market, this is the one that is predicting the highest impact on healthcare and life sciences. It accelerates drug discovery, predicts disease progression, and can personalize our treatments by analyzing complex biological data. As we've seen, this already gave huge results in the pandemic when we were able to generate vaccines in record amount of time and novel compounds from de novo to market launch within a few months. As all of you are aware, wearables and sensors are increasing exponentially, and the data generated by these has reached unprecedented heights in the zettabyte range. The combination of AI tools that can analyze this type of vast data and provide the strategic intelligence really can change the paradigm. If you are in healthcare and in healthcare tech, you've noticed a trend towards multi-cloud computing. And once again, the combination of the powerful AI models we have now and multi-cloud computing capabilities will allow us to have seamless collaboration across systems, helping healthcare organizations derive strategic intelligence without worrying about their privacy and security when it's done correctly. Of course, edge computing would allow us to have real-time processing of patient data from medical devices or wearables, and enabling us to have faster decision-making for those areas in healthcare that need such fast processing, such as ICUs, emergency rooms, or operating rooms. Virtual health platforms have been augmented tremendously by the power of AI. The same way integration, as we've seen, of AR, VR, XR with AI in multiple healthcare platforms is really starting to show the impact. With the change in population demographics that have been used to using these technologies in many other industries, I think over the next 5 years, we'll see even more increase in these. Federated learning and AI in healthcare is a passion of mine, and in previous webinars, I've addressed only this topic, but it allows us and enhances our ability to preserve patient privacy while enabling large collaboration projects. It is essential when we think about equitable care and global public health. Bioimplants have also risen, and the combination of generating insights with the power of AI from all these bioimplants has even sparked several researchers to promote an internet of medicine or an internet of bodies, because we have now all these bioimplants, all the nanotech devices in our bodies generating novel data sets that never existed before. Multiomics, another passion of mine, it allows us to collect data that have never been standardized in the past and integrate them with traditional clinical data sets, as well as the lifestyle patterns, and derive unique intelligence. For some of you that might be familiar with the semantic web, you'll also recognize the power of AI as an augmenter of the semantic web. It will enable intelligent data querying, improving access to relevant patient information that otherwise was never accessible, combined with our medical literature and combined with the power of the social media platforms. Of course, some of the companies are already working not only on Web 3, but most recently they announced that even Web 4, and we know in research labs, some are working on Web 5 configurations. So AI will obviously be a big component of those tech architectures. As we've seen recently, Neuralink was supposed to be a big disruptor. We already have 2 companies that are disrupting Neuralink now. The combination of brain-computer interfaces and AI in healthcare is extremely important when we think about the future. BCIs allow direct communication between the brain and external devices, as we've seen in the live demonstration projects offered by Neuralink. And by having the AI capabilities to extract this important data and analyze neural signals in real time, improving cognitive rehabilitation and enabling adaptive control of assistive technologies, will change the paradigm for numerous patients that before could have never had any help. Of course, we're talking about trauma patients and other patients with congenital brain disorders. Recent advances have also shown breakthroughs for exascale and neuromorphic computing. And once again, the combination of that computational power with AI in healthcare will allow us to enhance our predictive capabilities. Last but not least, as some of you know, next year, the United Nations has announced the year of quantum. So quantum sensing and quantum computing capabilities combined with AI will allow us to accelerate not only drug discovery, accelerate genomic analysis, and will create personalized treatment pathways that will revolutionize not only research, but also clinical care. Now that we had this whirlwind of exploring how AI and other converging technologies are changing healthcare innovation, let's talk a little bit about the barriers, which is our main focus today. There are numerous barriers in AI-driven healthcare innovation, and as a previous chief innovation officer for a company that was covering the whole United States, I can share with you the frustrations that a lot of healthcare teams are encountering. Additionally, I've had an opportunity to work with teams across multiple continents, and it is ironic and concerning to see that the barriers are equal no matter where you are in the world. Cybersecurity remains one of the major challenges we have when we're in the midst of deploying AI and other emerging or frontier technologies. We experience an unprecedented amount of attacks, and as you've seen, the impact of these cybersecurity threats keeps increasing. Ethical challenges. Almost every day in the news, we see how despite all the efforts, we continue to see ethical breaches and data privacy violations. These three, cyber ethics, ethics, and data privacy, are always on the top agenda of most enterprises that are deploying AI in healthcare. Additionally, as you are maybe aware, the legal and regulatory frameworks are trying to catch up and keep the pace of AI-driven healthcare innovation. But despite some major advances, we are still behind. Not only are we behind with generating healthcare and regulatory frameworks, but adapting these healthcare frameworks to the real-time operational needs. Having a beautiful legal and regulatory framework that everybody may endorse is not the same as having those translated into the operational workflows and being able to translate them into the enterprise needs for each department and each type of role. Trust has also been an issue due to the miscommunication, misunderstanding, and misrepresentation of the power of AI. It is essential to restore that trust, and I hope that webinars like these can help elucidate some of the real impacts of AI versus what has been misconstrued or misrepresented. AI health literacy is also important, and it applies not only to the general consumer, but also to the enterprises that are looking and seeking to deploy AI. It's really important to understand not only the AI tools, systems, platforms, and their real capabilities, but also the need for deploying them responsibly and truly understanding that the AI needs to be deployed for the correct use case in order to generate the results that we want. Another challenge and barrier that we've seen over the last few months emerge with increased adoption is sustainability. There are huge energy considerations that we need to think about when we deploy AI. As you've seen, some of the large companies have recently reactivated a nuclear power plant in order to generate the energy that is needed. So being able to deploy AI at the scale that we need to promote healthcare innovation and advance research, advance clinical care, and change the paradigm in healthcare might cause us big challenges in terms of sustainability and meeting the goals of the United Nations 2050 net zero agenda. So huge impact and huge concerns there. As I alluded to in my opening remark, talent and skill shortage. AI has taken a huge increase in adoption for healthcare, but the talent and skill shortage remains. And when we're talking about talent and skill shortage, it means that you need to have AI and healthcare expertise, as well as cyber and ethics expertise in order to be able to do well. So being able to have more talent and enhance, augment, reskill, upskill the enterprise employees is very important. The one that you are very familiar with, and we talk about it all the time in healthcare technology and in all technology deployments in any other industry, is interoperability and, of course, standardization. We still have major challenges in AI interoperability, and we do not have yet the standards that are needed for AI healthcare technology. They are being worked on, and we will soon hopefully have them operational. But for now, there is no universal standard, and it's causing tremendous challenges for enterprises. The other huge barrier is that we do not have customized AI-specific KPIs, and we do not have customized AI-specific OKRs. So teams are deploying AI-driven platforms and trying to apply traditional KPIs or traditional OKRs. And that, unfortunately, is not going to allow them to succeed. Again, there are numerous other barriers, but these are some of the main ones that transcend geographic borders and transcend the type of healthcare domains that we're witnessing. So now let's dedicate the rest of our webinar to how we can overcome some of these barriers and highlight a few of the business strategies for successful AI deployment in healthcare. I will first address business strategies at the board level, where it all starts. The board has to have the strategic alignment to ensure that AI initiatives align with everything else that the enterprise has in their digital strategic roadmap. AI cannot just be a little innovation team project, otherwise you'll have all those barriers we just talked about, not only data breaches and cybersecurity breaches, but also a lack of trust and complete chaos in your other KPIs and OKRs. Investment in innovation. Prioritizing AI funding with a focus on high ROI and patient outcomes is important. So we shouldn't deploy AI just for the sake of deploying AI. We need to be razor sharp focused on how it can change outcomes. Risk management. The board has to recalibrate, reconfigure, and reshape their appetite for risk if they are able to tolerate AI deployment for healthcare. Oversight and accountability. Educating the board about AI and AI converging with the other emerging and frontier techs is important. Otherwise, they cannot provide the oversight that's required. Additionally, having the stakeholder engagement from investors, other strategic partners, suppliers is essential. You cannot create an AI-driven healthcare ecosystem in a vacuum. You need to collaborate with everyone else. Additionally, here are a few C-suite strategies. If you already secured board engagement, you must have the C-suite aligned as well. So not only do they need to rethink and change their business models, because traditional business models do not fit AI deployment. They have to have a totally different way of allocating resource. We've seen the pace of AI developments almost every month. You have another model, another enhancement, and enterprises need to keep up with that. Traditional resource allocation will not be sufficient. Change management. It used to be that a project in healthcare could take 15 months. Now you're pressured to sometimes deploy a novel AI project within weeks or a few months. Collaborating with other tech providers, so leveraging the power of collaboration is essential if you want to succeed in AI-driven healthcare innovation. Otherwise, you'll be outperformed by others, and by the time you finish a project, you already have 5 competitors that disrupted you. Regulatory compliance at the C-suite is very important. That does not mean to just comply with the laws and regulatory frameworks that are in effect now. What this means as a strategy is to be ahead for 2 years, 3 years, 4 years from now. So monitoring completely the landscape of regulatory frameworks is essential when you deploy AI. So by the time they come into fruition by a year or 2 from now, you're already ready and your AI system is capable to comply with those. Of course, after securing board and C-suite level, you must have a management level strategy. Just sending out an email from the C-suite that an AI program has been launched is not sufficient. Management has to be trained and upskilled. They need to understand how to do data governance in an AI-driven environment, which is completely different than the way they were trained or accustomed to. They must have multidisciplinary teams that are highly versatile, not only in AI, but cyber, ethics, and other converging technologies like we showed before. Starting with small AI pilots is good to test effectiveness, but you must also train the team to understand the difference between managing a pilot and managing a scaling effort successfully. I cannot emphasize performance monitoring enough for AI. Many teams launch AI and then they forget to do performance monitoring. AI needs to be retrained. AI needs to be monitored. You need to have continuous feedback loops in order to succeed. And of course, we can't forget the employee level strategies, which are the most important for success. AI literacy and awareness, collaboration with AI systems. So that means hybrid augmented intelligence workflows. Humans will be somewhere in the loop, even if they're before, in, after the loop, if they're coaching an AI, if they're providing oversight of an AI, if they're just going to approve an AI outcome. So humans will somewhere be involved in healthcare AI-driven innovation. These feedback loops have to be continuous and have to be monitored as well. Ethics and accountability for healthcare is a must. And of course, at the employee level, sometimes it's much more difficult to monitor, but it's essential for success. In order to succeed with AI-driven healthcare innovation, you have to have the adaptability and flexibility. And the only way that works is if all your employees are equally trained and provide that infrastructure that allows you to succeed. So now that we highlighted the business strategies, we're going to talk about the technology strategies. One that I want to highlight that I've also been dedicating myself to over the last few months is AI orchestration. You cannot just keep deploying 50, 60 AI pilots all independently. There must be appropriate AI governance and AI oversight. And AI orchestration, in my experience, is the only way to get it right so that you can also adapt to novel AI tools and systems and to all the other converging technologies that we mentioned. So truly, you need AI orchestration in combination with deep tech orchestration. Having a systems thinking approach is, in my expertise and experience, an imperative. If you do not understand that AI is just a small component of a larger ecosystem, it will not succeed or not give you the ROI or the outcomes that you strive for in healthcare. So really important to have a systems integration approach. Hybrid augmented intelligence workflows, as I alluded to earlier, are essential. Particularly in healthcare, we will always have either the patient in the loop or the family in the loop or the healthcare professionals in the loop, but there will be a human in the loop. Scalable cloud-based AI infrastructure. As we mentioned, cloud-based systems and multi-cloud computing are taking healthcare by storm, and the combination of cloud-based systems with 5G, 6G, satellite internet will further increase this need. Another important element for success is cyber resilience, and it deserves special attention because, as we've seen, one cyber attack shut down the United States healthcare ecosystem for several months. One way to succeed for AI healthcare innovation is adopt the zero trust architecture. As we've seen, NIST has published version 2 of the zero trust approach, and I strongly recommend all organizations to adopt a zero trust architecture to ensure that not only AI, but all their other deep tech platforms are able to resist the current cyber threats. Leveraging quantum-proof encryption, also important. As we've seen, NIST has published several novel standards, and quantum-proof encryption is what's being focused on over the next year or two. Enabling federated learning for secure data exchanges, as we highlighted before, being able to analyze encrypted data in the cloud and engage in large collaborative efforts for equitable health is essential. Implementing data mesh and data fabric in addition to zero trust and in addition to quantum-proof encryption and in addition to federated learning can start to create a novel cyber resilient healthcare ecosystem that we don't have right now. Last but not least, one area that I've been also talking about for the past few years is leveraging digital twins. So creating cyber-focused digital twins for predictive threat monitoring is also a tremendous tool that we are not utilizing at its full potential. Ethics resilience, and you might not hear this term used a lot, but ethics resilience for all deep tech, but specific focus on AI, is essential. Just having an ethics policy that's in a beautiful digital drawer will not help you succeed. You need an ethics program. You need an ethics ongoing, not only program, but also an ethics innovation pipeline. So embedding ethics in your innovation pipeline is what secures your ability to adapt to all the novel AI-powered converging technologies. It will allow you to align the AI ethics program with other enterprise priorities. It will allow you to embed ethical guardrails in all hybrid workflows. And it allows you to deploy robust AI ethics and quality assurance, quality improvement, or auditing programs. It will also allow you to have cross-functional cyber ethics programs that can be aligned with the DEI and ESG priorities. Last but not least, you should consider innovative decentralized cyber ethics approaches, which have been published over the last year and unfortunately have not had as high adoption, but it's really important to consider. So we talked about business strategies, technology strategies, and now I would like to also focus on sustainable strategies for AI innovation in healthcare. In order to have sustainable AI innovation in healthcare, you must think about building ecosystems to succeed. As we mentioned, you cannot survive in a vacuum in healthcare in general, but for AI-powered healthcare innovation, you really need to think how to support your partners, your suppliers, your feeders of your healthcare ecosystem. As we mentioned, in addition to applying systems thinking for sustainability as well, you need to embrace exponential thinking, revise your risk tolerance, recalibrate for dynamic budgeting, have novel management styles, novel funding sources, and novel investment instruments that fit this rapid advancement and rapid deployment. And a term that I launched last year is multidextrous leadership style. Leaders in this era cannot afford to just have one skill. They need to be multidextrous in order to sustain AI innovation. We're nearing the end of our webinar, and I would like to conclude with a few thoughts on the future of AI in healthcare. It is evident, as we've seen by NVIDIA, Globant, Dassault Healthcare Systems, Siemens, Philips, several other organizations, including Amazon, have launched multi-purpose AI platforms. The development of these versatile AI platforms that support multiple healthcare functions, from diagnostics to treatment planning to operational efficiency and administrative tasks, will create, hopefully, a unified AI-powered ecosystem for healthcare organizations. I would also like to highlight the rise and the need to prepare for AI-powered human-computer interfaces and AI-powered brain-computer interfaces. It's not easy to adapt to these, and once they will be increasing, enterprises that are ready to absorb such data will be leaders. The healthcare metaverse was mentioned quite a lot in 2021, 22, 23. This year, we've not heard that much about it, but it's silently developing. And we see an increase in virtual healthcare environments powered by AI, and they will infuse all other environments such as virtual care, smart healthcare, and digital health in general. Additionally, we've seen industrial healthcare omniverse rising. Multiple major companies have been able to allow real-time simulations of entire healthcare ecosystems, optimizing hospital operations, emergency rooms, ICUs. We've seen the launch of medical training being done completely in virtual environments, supply chain management. It has infused all the industry. Another development that we predict for the future is that smart health cities will rise. At this point, we only have several cities in the world that have a robust smart health care infrastructure. But if we want to sustain for long term, we must embed AI into all our smart city projects. And that involves smart city public health as well, smart city precision health as well, and generating real-time analytics that truly change global health. Last but not least, I was surprised to see at several conferences the amount of advancements that we see in space health. Space industry has increased, and with it, space health has become an unexpected new niche market. So I would like to alert you to and invite you to read a little bit more about space health and the amazing opportunities we have to leverage what we learned from healthcare on planet Earth and how it would be completely different to maintain health and prevent health in space, and vice versa. We have learned from space research for healthcare quite a lot of things that we could take back and apply here on Earth. So with that, I would like to conclude and open up for any Q&A. Thank you so much for the opportunity to share a few thoughts.
Thank you, Dr. Ingrid. Wonderful presentation. Thank you for serving today, and great information. Let's just check and see if we have any messages here. I'm looking here in the chat box. I was going to ask, with what you presented, I mean, obviously AI is consistently evolving. Is this something that, like, people in the healthcare industry, whether, if you're a physician or just a healthcare practitioner, something that, that maybe not all, but are going to have to be really, up to speed on AI? I mean, like, continuing education in that particular area as this technology continues to evolve?
Absolutely. 2 points. Actually, it's the first time in history where enterprises don't have to push technology on the employees. The employees have demanded to have this technology. So the reverse happened. And to your point, yes, enterprises are launching AI education. It's often as part of a technology education, but also for ethics. So many enterprises that understand the risks and barriers we just mentioned are offering educational programs for their employees to understand how to deploy AI to improve their workflows, to improve efficiency, but also to deploy it responsibly, because the danger is that out of too much enthusiasm and too much desire to increase your operational efficiency, you do things that can harm the patient or the enterprise. So absolutely, yes, they are being incorporated in robust programs. But even those will need to be improved, because like we learned before, just watching a video or answering a few questions doesn't mean that you will know how to deploy AI successfully.
Yeah, no, I agree. That's the reason why I had asked, because I know it's more than that, but it's just exciting to see how all of this is taking place in the healthcare industry. And I definitely think from what you shared, it's definitely going to enhance so many areas and make the process more efficient. So thank you for sharing that.
Thank you. Yes, and just I always like to joke that with EHRs we had to incentivize, threaten, wait 10 years for people to adopt EHRs in healthcare, and now with AI it's the opposite. All employees are eager to deploy, and we need to hold them back. So total
Exactly.
opposite than EHRs.
My camera went out there for a second, but we're back on. So no, thank you so much for serving. I'm just seeing if there's any more, if there's questions here. I'm not seeing other questions, but I did want to leave before we conclude, if there was any final thought you would like to share with what you shared today. Anything just with high impact that you'd like to leave the audience here.
The only area that I neglected to hone in enough on, I think, is the influence that patients have. So over the next 5 years, it's predicted that the generation that are digital natives will be the ones that are the workforce and are majority of the society that consumes healthcare. So they will further increase the demand of these converging technologies, not just AI, because they're highly versatile. They've grown up with them. So again, if anyone thinks that this will go away, it will not go away. It will actually increase. So I maybe didn't emphasize that enough, that our patients will become the digitally natives and our workforce will become the digital natives by 2030. So we can expect all of this to further accelerate.
Thank you so much for sharing, and thank you for taking time today to be with us for this valuable insight and content that you shared here on this webinar.
Thank you so much for the opportunity, and looking forward to receiving further questions after.
Sure. And we did say thank you. Somebody, a LinkedIn user said, thank you, Dr. Ingrid, for a wonderful session. For a company willing to implement responsible and methodological AI, is there any process you would recommend to follow, like, for an example, of the Optica tool published lately in NEJM?
Oh, yes, absolutely, definitely. There are several responsible and methodological AI frameworks, tools, guidelines, playbooks. And what I would like to always emphasize is all of them can be great, but you have to customize them to your use case in your enterprise. So caution, even with the great things that are being published, that you cannot always translate them directly to your enterprise. So do a proper feasibility analysis. And if that's the right methodology, absolutely. But we're valuing these type of frameworks, absolutely. And I see another question.
Yes. Yeah. Which specific areas are the talent shortages most prevalent?
Absolutely. QA, QI for AI is virtually inexistent at this point. Integrating AI with ethics and integrating AI with other healthcare facets. So we have great teams that are used to healthcare informatics, traditional healthcare informatics, and we have great AI teams, but they're not accustomed yet to work together. So being able to augment or reskill and upskill or cross-skill them will be important.
Oh, thank you so much. Any other questions that anybody has here or even from LinkedIn that would like to share? Okay, and if there are any questions for Dr. Ingrid that come later, we'll make sure that she will get those questions. Did want to announce again the Global Health Tech Summit, November 20th is taking place. Again, we want to create awareness now. Get registered. Actually, Dr. Ingrid will also be presenting on that summit here. And again, we'll be here by the time we know it in about a month and a half. So again, we want to make sure everyone gets that on their calendar. And that's going to be a good half day that we'll be having a lot of experts sharing on that particular summit. So we encourage everyone, make sure get that on your calendar. A lot of great content to be shared here today. And we want to thank all the viewers that are here. And again, Dr. Ingrid, great session. Thank you again for being here.
Thank you so much for inviting me and looking forward to continuing the conversation at our summit.
Thank you. And take care, everybody. We'll see you on the next webinar and the Global Health Tech Summit. Take care.